Okay, so before we go in, we reviewed the patient charts. We have a 50-year-old female who has Guillain-Barré's syndrome, which can cause muscle weakness and general weakness overall throughout the body. So the precautions that we're going to take, we're going to definitely bring our gait belt in, and we're going to monitor the patient for falls risk and balance. Before you go see your patient, you need to gather your equipment and then also wash your hands. Gather my equipment and have washed my hands. I am prepared to enter the room and make contact with the patient. I am going to knock on the door, enter the room, sit at the level of the patient, identify myself as a student physical therapist assistant. I'm going to make sure that the patient that I have is the correct one by patient identifier and getting their full name. I am going to get a set of vitals on the patient before we do anything, and also a pain scale. I am also going to get consent from the patient. And then we're going to explain the procedure.
Come in.
Hi, how are you doing?
Okay.
My name is Anthony. I'm a student physical therapist assistant. I'm going to be working with you today. Before we get started, can I get your full name, please?
Brittany, 5/16, 1964.
Okay, I do have the correct patient. Can you tell me today, ma'am, if you're experiencing any pain?
Yeah, well, not so much pain. I just feel really weak. Like, I feel like I can't really do much.
Okay, so just general weakness. On a scale from 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever felt, would you say, what would you say your pain is on that scale?
Like weakness-wise, I would say like an 8. I feel like I can't even like stand up straight, like I'm gonna lose my balance or something.
Okay, so we'll just put no pain but weakness you're experiencing. Okay, and today the physical therapist wants to have you get up out of bed, and we're going to be transferring you to a wheelchair. Do you feel that you can do that today?
Yeah.
Okay, so I have received. Alright, well, I'll be here to assist you. So we have received consent from the patient. Okay, ma'am, we're just going to get a quick set of vitals on you before we do anything, just to see how you are right now, okay? So you're going to put this on your left index finger. There you go. Just go ahead and rest it. I am going to get a blood pressure. I want to support the arm and keep it at a level. So I'm going to use my knee here to keep the arm at the level that is desirable. We're going to go ahead and get some blood pressure and the pulse ox. Now that we have made contact with the patient and received consent and explained the procedure, we are getting ready now to perform the transfer. First step in this transfer is we're going to have the patient bend the knees, and we are going to perform a log roll to the patient's right side, so that way they are side lying. Once the patient is side lying, we're going to want to perform a scoop maneuver to have the patient sitting at the edge of the bed. That maneuver is done with one hand underneath the leg in a scooping fashion, and the other hand underneath the shoulder also in a scooping fashion. You're going to perform the maneuver and have the patient sitting at the edge of the bed. Once the patient is sitting at the edge of the bed, you're going to want to put a gait belt on them and do not lose contact with the patient. You want to have one hand on them at all times. Once they are sitting at the edge of the bed, we are going to now perform a stand pivot transfer to the wheelchair. So with this stand pivot transfer, you're going to want to make sure that you have a wide base of support. You want to make sure you do not do any twisting motions. You want to lift with the legs, and you want to make sure that you protect your back. And then once the patient is up and we perform the stand pivot transfer, you're going to want them to reach back with their hand to grab the wheelchair and then sit them down in a controlled fashion. Okay, ma'am, so now that we have received all the vitals and everything, we're going to go ahead and sit you up. But before we do that, I'm going to have you bend your knees, okay, and then we're going to go ahead and roll to your right side, okay? So if you can bend the knees as best as you can. If your patient is weak, you can assist them in bending the knees, okay? And then you're going to want to have one hand supported on the hip and the other hand supported on the shoulder, and instruct the patient to roll to the right side. Okay, ma'am? So on the count of 3, we're going to go ahead and roll to the right side, okay? So on the count of 3, 1, 2, 3. Perfect. Okay. Now that the patient's here, you're blocking so the patient doesn't fall over. You're using your body as a barrier so that way the patient feels secure. You want to have one hand on contact with the patient at all times. Okay, ma'am? So now we're going to go ahead and sit at the edge of the bed. Okay, I'm going to assist you as much as I can. We're going to do a scoop maneuver. So again, with the scoop maneuver, it's going to be one hand underneath the legs and the other hand is going to be underneath the shoulder, and you're going to be doing a scooping motion to have the patient sitting at the edge of the bed. Okay? So on the count of 3, whenever we're going to go ahead and sit at the bed, okay? 1, 2, 3. Okay. Now that the patient's here, you want to keep in contact with the patient, making sure that you have one hand on them at all times. Grab your equipment, your gait belt here, and we're going to go ahead and put this belt on you for safety, okay? Is that too tight? It's fine. Okay, now that we have the patient sitting at the edge of the bed here, we're going to perform the stand pivot transfer to the wheelchair. You want to make sure the area where you're transferring is clear of all obstacles. You want the chair as close as possible, and you want to make sure that you apply the brakes to the wheelchair. Okay? So, ma'am, so with this procedure, what we're going to be doing is we're just going to go from sitting to standing. We're going to rotate and sit down in this chair. Okay? So while you're performing this transfer, you're going to want to block the knees with your knees. Okay? Make sure that the patient is secure. The feet are not going to slip out. You want to make sure that the patient has non-slip shoes. Okay? So as much assistance as you can help me with, we're going to go ahead and try to stand up. Remember to bend your knees and don't use your back. Get to the level of the patient, and then we're going to go ahead and stand up on 3. Make sure you use those commands. Okay? 1, 2, and 3. Okay. Now that we have the patient here, we're going to do what's called the pivot transfer. So you're going to want to use your legs to pivot, and remember to take your time and do it safe and slowly as possible. Okay, and then ma'am, if you can just reach back for the chair with one hand, and we're going to go ahead and sit down, okay? On the count of 3. 1, 2, 3. And perfect. Okay? Now that the patient is secure in the wheelchair, we can go ahead and transfer them to the gym. Now that we have successfully performed the transfer and the patient is sitting in the wheelchair, we are going to apply the footrest and the leg rest. We are also going to get another set of vitals on the patient and ask the patient another pain scale and see how they're doing. Okay. Alright, so now we're going to go ahead and position for comfort. We're going to place the footrest back on. Here, and then this one's broken. Okay, and then we're going to go ahead and get another set of vitals on you. If I could just see your left arm. Vitals have been taken again. The patient is stable and safely in the wheelchair. We're going to go ahead and remove the gait belt, and we're going to ask the patient if they have any further questions. So we're going to go ahead and take this off for you. Okay, and then are you in any pain?
No, just feel weak still.
Just feel weak? Okay, any questions for me? No? Alright, well we're going to go ahead and transfer you to the gym, so that way you can get started on your physical therapy. Okay? Thank you.
Thanks.
The treatment is completed. Do not forget to wash your hands. Damn it. And this one's broken. Okay, and then we're going to go ahead and get another.
Wait, oh God. Really? Seriously?
You cut it. Ready?
Yeah.
All right, go.
Bye, guys.
Bye.
Thank you.